completely agree that, you know, what has happened in social care is that there is virtually no public provision of social care now at all. Tiny, 10% maybe, of social care, whether it's domiciliary care in the home, whether it's residential care, it's now overwhelmingly non-public provision. And a lot of it is not very good quality provision, not because the individuals involved are malignant or wish to be, but because they have been casualised, they are underpaid, their working conditions are very poor, etc. My fear is that particularly as we move services into the community for healthcare, we're going to see more of that. Because if you implement market forces and competitive processes in a context of funding constraint, you end up pushing the quality of staffing down and pushing the quality of care down. So it's a very important thing. These are 4 focuses or demands that our campaign is going to have in the coming 12 months. And we want concerted action between now and the general election. First of all, we demand that funding of the NHS increase by 4% in real terms each year of the next Parliament. Second, we demand an NHS reinstatement bill. And I gather that an NHS reinstatement bill is actually being drawn up as we speak by a group of experts who have legal expertise. A very short bill which will, if passed, would essentially eviscerate the Health and Social Care Act without having to get into very protracted legislation around the repeal of the Act. So at the moment, a group of people are designing an NHS reinstatement bill. We want this. This is going to be national. We're going to be supporting this locally, but this is going to be a national effort. Thirdly, we demand that the organisation or reorganisation of healthcare services be founded upon a solid evidence base and not simply a so-called case for change. So if we are told that things need to change, we want to know what the evidence for that is. And we want to know what the evidence is that this is going to be a better way of doing things. And finally, we demand that all workers providing health and social care be paid the living wage, and that those commissioning health and social care services require this of organisations to contracted to provide care. And we recognise that there may need to be a transition period on organisations to get themselves into place, but that is what we want to see. In social care, most people are paid just above the minimum wage. So you can have 100 different demands. These are 4 that we are going to be focusing on. They are going to be to do with privatisation, and they are going to be to do with the funding situation as well.